Kylie Jenner's face breaks the internet. And this time around, she was spotted in Paris attending a fashion show by Jean-Paul Gaultier, and fans couldn't help but notice that she looks older than her age. She looks like, some of the fans claimed that she looks like a 70-year-old woman. Others claimed that she looks 39, 49. There was so much of speculations, and no one speculated that she looks like 26, which is her real age. So, without much ado, let's take a look at this video from Dr. GB, an esthetician based in London, who tries to explain what might have happened with Kylie's face. So, let's go.
Kylie Jenner was recently seen at Jean-Paul Gaultier's show in Paris, and people are wondering what's happened to her face. Well, if that's you, then keep watching to find out why. The most obvious area which I'm drawn towards is the mid-cheek, where you can see a line forming along it, which is emphasised by the change in shadows. Quick anatomy lesson: this area of the face can be demarcated into different zones, and with Kylie, the areas of concern is the purple zone representing the malar mound or festoon, and the red line which marks out the mid-cheek crease. Looking here where I've marked up Kylie's face, the green arrow represents the festoon and the white arrow points to the mid-cheek crease. Festoons are swollen mounds that appear in the lower eyelid and cheek area and commonly occur with age. However, in Kylie's case, there's likely another contributing factor, which is filler in the cheeks and/or under eye area. Filler is hydrophilic, water-loving, so if too much is used in one specific area, it can lead to intermittent edema, which is the buildup of fluid. From the front on angle, it's not as prominent, but you can still see the mid-cheek crease. Did you notice this? Let me know.
I feel so sad because, you know, this kid was born into a family where they were so thirsty for fame, because she was pushed at a very tender age to get fillers, to get BBL, to get surgery in order to look appealing to the brand, you know. So I feel so sorry for her. I feel so sorry. This is what happens when you have a manipulative and narcissistic parents like Kris Jenner and her husband, Kathleen Jenner, or whatever. You know, when you've got such parents, like a dad who wants to be whatever he wants to be, and a mom who is so desperate for her daughters to be in the limelight, to be superstars for at any cost. This is what happens. I mean, Kylie was just 15 or 16 when she was pushed to get fillers on her lips, and she lied that getting the fillers, she lied that using her lip gloss, you're gonna have full lips, your lips is gonna plump. But she was lying, as we all discovered later, because she did like lip fillers in order to get the plump lips. But she lied to a whole generation of girls, young girls, who were also looking up to her and wanted to look like Kylie. So this is the result. This is the result, you know. It's not just Kylie. A generation of young girls have been affected by Kylie's lifestyle, by the way Kylie looks online. You know, so many girls have also undergone surgery, have also had fillers and all these, just to look like Kylie. So I hope that these kinds of videos and pictures are going to show the young girls who are still looking up to people like Kylie to understand that what you see on the internet is not the same as what you will see in real life. Because I know all the outrage now is just because people have been seeing them with filters, with makeup, being photoshopped. And you know, these people have their professional photographers. And before their photos hit the internet, they make sure that it comes from one source. A source that has been verified to be sure that it's the kind of picture that they want to be in the internet. So this one is like, it was taken by someone else and uploaded online without their permission, because this is a taboo for the Kardashians. They will never show you themselves without makeup. It's the same. I just came across a video of a lady saying that she's never seen Kloe Kardashian. I came across a video of a lady who said she's never ever seen Kloe Kardashian without makeup. You know, everything she sees, she googled and she couldn't find anything. She just found one video of her sitting on the floor and playing with her kid, but her cap was down at her eye level. It means like you can't really see her face, like her full face. They always Photoshop. They make sure everything that comes to the internet is picture perfect. It's perfect to the T. So I digress. Let's focus on the matter of today. And we all know is Kylie Jenner's face. So there are a series of videos I'm going to run, and then we watch and we listen to professionals talking about why her face looks the way it does. Check this video of the facial planner as she explains why she feels that Kylie Jenner's face has been overfilled.
How do we know when filler is just too much? Of course, this answer is going to be different for everybody, but a little trick that I think of when I think it's too much filler is when your expressions, your smile, your teeth, your laugh, everything is starting to look a little different than it used to. When you get filler, normally in your piriform aperture here or in your lips and also in your cheek here, it starts to press on the muscles. For example, piriform aperture is going to press on that L-san muscle that we talked about that is lifting that smile. Same thing, cheek filler, you have this muscle that runs along here called the risorius muscle, and that's what's opening your smile. So when you get too much filler in these areas, they start to press down on those muscles and make it hard to express. Smile, laugh, Botox, too much Botox can make you frozen and you can't fully express your face. That's sometimes this patient preference, but that is my trick for knowing when it is too much. And the last thing we want for people is to not look like themselves or not look natural or feel like they can't go about their day laughing, smiling, making normal expressions.
I kind of like the fact that we are not just talking about Kylie Jenner's face. This has also sparked conversations around fillers. Why fillers are good and why fillers are not good, and the pros and cons of fillers. Let's take a look at a video of a professional talking about how there is a trend of celebrities taking off fillers from their face. For instance, we got Black China, who came out recently and was saying that she's taking off the fillers from her face, taking off all the BBLs and all. But this professional is saying that she is quite sure that they are not taking out these fillers completely. They are taking out the fillers that were done wrongly, and they are trying to do it rightly this time around. Let's check it out.
Celebrities dissolving fillers. But are they really dissolving all their filler and then leaving their face untouched? I'm not so sure. Not only is this trending with celebrities, but there is definitely a significant increase in the amount of corrective work that we're all doing nowadays in our practices. Now, these patients come, they've been injected elsewhere, maybe many places before they arrive, and their treatments are potentially not doing them any favors. It's obvious they've been treated, and aesthetically, their outcome may not be as natural or as pleasing as they were hoping for. Our best option is to remove all of that filler, but then go through a process of slowly refilling with great intention, with a natural aesthetic outcome in mind, and with a strategic, anatomically appropriate plan so that the filler that is replaced will look absolutely undetectable. And honestly, as I look at a lot of these images of celebrities that are getting all their fillers removed, and I see them in their natural state afterwards, I'm very suspicious that they've just been filled better.
time, everyone in the beauty business, but also a lot of you are talking about this. What is that? What's going on with her cheeks and her under eyes? She's only 25. Wait, I have to go check. She's 26. Only 26. So, what is happening to her face? A lot of you are guessing that is under eye filler that probably has migrated and is looking so bad, especially in some lighting. And I got to tell you, as an RN injector, as a nurse aesthetic in the beauty business, I get to inject filler. I refuse now to inject hyaluronic acid under the eyes, but this doesn't look like a filler to me. She looks like she's swollen. Come on, guys. I know you are so worried about filler, and this is another opportunity to just make you not to get filler. But this particular case, I think, is just she's swollen. I get like this after microneedling. So it could be a microneedling, it could be another beauty procedure that left her with a long-term swelling of that area of the face. Like, you guys, Kylie Jenner has access to the best injectors, best plastic surgeons in the world. You think that they will let her go to events like this, looking like this, by doing a very bad job injecting filler on her face? Yeah, I disagree. I think it was just some post-procedure swelling or a long-term procedure swelling at this point, because I don't think she will take chances to do a procedure, a beauty procedure, only a couple of days before this event. But she probably did with thinking that the swelling will go down, and I guess the swelling is just lingering there.
Oh, poor Kylie. This might be beyond her control because, as she rightly said, Kylie Jenner or the Kardashians can never bear this kind of risk to go to such a big event looking like this. No, she will never. Not a Kardashian, not a Jenner. Whew. I hope that she finds help. She gets the much needed help that she needs. She gets the best surgeon, the best doctors to address this, because it doesn't really look good and it also doesn't look healthy. She doesn't really look happy. I don't know if I'm the only one who sees this, but I see that she is not happy. She is not happy. She doesn't look happy. Whew. Guys, I'll tell you that I have learned so much about fillers, Botox, everything around the subject. I've learned a lot because of this whole controversy about Kylie Jenner's face. And I'm going to talk about some of the comments that you all need to see. So like this one from Shauna says, yes, here is what a surgeon told me. They start with fillers and that creates laxity on the skin by stretching out the surface. Then the Botox makes the muscles in the face atrophy from lack of use, and the combination of both leads to early aging and early face lifts. These procedures aren't meant to be started in your teens, 20s. They are to be started by women in their 40s, 50s or so. And we all know that this kid was forced by her sister and her sisters and her mom to go and get fillers at as early as she was 15, because this child started when she was 15, started pushing her lip gloss line and all that, So she was a baby. You're a kid. As long as you're 15, as long as up to like 20, some parents still consider their kids as kids. So kids should be treated as kids. But in this case, this child was forced, she was manipulated to be what she is. So Kris Jenner is responsible for whatever is happening in Kylie Jenner's life at this point. And I'll tell you, she doesn't really look happy. She doesn't really look happy. And I feel so sad for her. I feel so sad, and I'm so worried about her, because there was also some information about Kloe Kardashian taking off a cancerous cell from her face through an operation or so, but she never really talked about it that much on social media. You can see everyone is just talking about how she started early, and now everything is making her to look older than her real age. Almost all the comments are talking about the same thing, about like, okay, this is a 26-year-old, but she looks older than her real age. She looks older for a 26-year-old. So guys, everyone, no matter what they're talking about, they are worried. They are so worried. I hope that the Gen Zs, the millennials, the Gen X, the generation snowflakes are seeing all these and are taking and learning their lessons, because these kids don't learn their lessons. I just came across a pharmacist talking about fillers, and like she was just creating awareness, and she had a picture of Kylie Jenner, like the green screen picture. And you know, when you go to the comment section, the people who are really outraged and triggered are the millennials, the Gen Zs, and the Generation X, the snowflakes generation. They are more worried about why people are talking about it than being worried about the health effects attached to these procedures. Do you understand? They are more worried about, she's going to be depressed, she's going to be traumatized because so many people are dragging her, blah, 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 blah. I'm like, what? So you don't really care about the health aspect of the matter at hand. You are more worried about how she's going to be traumatized, she's going to be depressed because people are bringing awareness, people are stirring the pot. This has sparked a lot of conversation around this topic. I'll tell you that I'm so happy, I'm so pleased, and I've learned so much because of this controversy. I've learned so much about fillers, the pros and cons. I have learned, because we just see fillers, we don't know anything about it. And you know, the Kardashians always come here with photoshopped, perfect picture. You know, you just see them, you think everything is so nice, so rosy, you know. No, it's not stressful. So you can just go to the doctor's office and get a filler. No, it is. This is the result. This is what happens when you do too much of it. So I hope that the next time you see these kinds of pictures of the Kardashians, you will just know that this is Photoshop. This is like the avatar picture. This is what I call it, because most people don't look like this. No, they don't look like this in real life. They use Photoshop, they use all kinds of tools in order to make themselves look this way. And you come online, you take these pictures to your plastic surgeon and tell them that you want to look like this. I want to look like Kloe Kardashian as she looks in this picture. This is not how Kloe looks. Check this video of a doctor talking about some of the procedures that Kloe Kardashian has done and how it's destroyed her natural face.
I mean, it was beautiful, for sure. I just would have loved to seen you in that at the after party and then something prior.
Okay, let's talk about it. Many of the comments on this video are saying, what's Kloe done to her face? Has she had eye surgery? How has she changed so much? Let me tell you what's happened. I'm an aesthetics doctor based in London, and this is the classic example of overfilled face syndrome. Has that classic appearance of too much dermal filler, specifically in the cheek area, so it's pushing up and causing her eyes to do this and giving a squint-like appearance. This is a prime example of filler gone too far, and I think it's really important when you're having these treatments done to go to someone who is going to have a less is more approach and still keep you looking like yourself. Dermal filler, if done correctly, can certainly help improve someone's appearance, but in my opinion, Kloe has gone too far. But what do you think?
So guys, this is what happens when you get overfilled. You get overfilled face syndrome, and it can lead to more complicated health problems. But in this case, we don't know what is going on, because the Kardashians only show you what they want you to see. They want you to see that they're picture perfect, they've got the perfect body, the perfect face, you know, and they use all these to push their brands. But I don't know. I have never bought anything from the Kardashians, because everything they try to push and make it look so perfect, I can still see the same thing in the shop for cheaper. Because most of their things are so expensive. I don't know why you all are so glued to the Kardashians. Why?